Bruce Chabner is a legend. He is everyone's favorite uncle.
He has a thing about cancer. He doesn't like it. He has a passion for doing it in.
What he has done as the instigator, the stimulator, the leader, the inspirer, really, at Mass General, is not likely to be replicated again anywhere.
He's a role model in terms of his integrity, in terms of his commitment to science, and ultimately what science means to better answers to this dreadful disease.
I'm Solomon Thompson. I'm Bruce Chabner's grandson, and I nominated him for the 100. I feel like he, just as a person, is very motivational, and he's one of the bigger role models in my life.
His knowledge of not only basic science, but clinical science is superior. And he combines that knowledge with such an inquisitive mind. I can't think of anyone, frankly, who has been more important at the interface between academic research and the private sector in the area of oncology.
Well, Bruce Chabner, you could describe in the following way. He's a remarkable clinician, scientist, clinical investigator, and a great mentor and builder of teams. He brings a human sense, a depth as a personality to bear on what happens around here, and it has a very transforming effect on everybody around him.
I think one thing a lot of the young folks don't know about Bruce is his role at a national level in cancer. He directed the clinical operations of the National Cancer Institute for over 20 years. They might not know he's an admiral in the United States Navy for his service to the Public Health Service. And they don't know how he, in the 70s, helped change the landscape of cancer care. He fought with the Senate, he fought with the Presidents of the United States to get more allocation for cancer research.
Bruce's compassion, not just for cancer patients, where that would make sense, but his compassion for our faculty, our people, building the support services that were so integral to really providing what we needed for our cancer patients. Bruce had a vision that was much deeper than anyone I'd ever had the opportunity to work with before.
When Bruce came here in the late 90s, medical oncology was quite small. And when he finished his tenure as the leader of medical oncology, it was one of the most dynamic programs in the United States.
Massachusetts General Hospital is on the leading edge of so many areas of medicine. But in the area of investigational oncology, I think we have to take off our hats and acknowledge and say the laurel goes on your brow, Bruce Chabner. Thank you, thank you, thank you. Not just for me, but for my cohorts.
I think Bruce is quietly effective. He really builds consensus. I've seen him operate in committees, and I think that's why he's a good teacher and administrator. I think he's able to get people to work with him and do things and get things accomplished.
Because of Bruce Chabner, thousands of women across all socioeconomic backgrounds have gotten cancer screenings, and countless lives have no doubt been saved.
Bruce has dendritically, expanded his reach through this global network of fellows who not only are bright, energetic, patient-centric, but have a certain special zeal of doing the next right thing. And I'm certain that every one of them had that intrinsically in them, but that it was brought out and amplified by virtue of the role model that Bruce Chabner is to us all.
He taught me to mentor other people and to continue this legacy of his, of thinking of the world as a big tent, to bring everybody together, to be inclusive, to think that we all have a role.
I love you, Bruce.
Dr. Chabner, thank you for your deep and long commitment to serving the underserved.
You have and continue to be a role model for many of us in the way you conduct yourself as a professional, but equally how you share yourself with all of us as a friend.
Thank you for being a national treasure.
You are astounding.
I love you, and congratulations.